Hey everyone, welcome back to the channel. Today's topic of conversation is the impact of hydronephrosis on the kidney anatomy itself. And if you've been following along, we just finished up a video on the different grades or severities of hydronephrosis, but today's topic of conversation is going to dive a little bit deeper into the weeds to talk about the actual impact that hydronephrosis has on the kidney as it relates to potential damage. So we're going to dig into this a little bit deeper to give you the information that you need to be able to better understand what's actually happening in your body. Now, if you're interested in this information in a written format, I would encourage you to check out our education blog series on our website. There is going to be a link down in the description below. And as always, if you find this information valuable, please smash that subscribe button. Helps us get in front of kidney stone sufferers just like you and I to get them the information that they need. Now, without further ado, let's dive in here. So when it comes to the kidney, there are really, it is a complicated organ. However, there are really two main functional parts that we're concerned with when it comes to hydronephrosis. So the first thing that we're going to take a look at is something called the Pelvicalyceal System. And this is just a jammed together word that deals with both the renal pelvis, which is the river delta, if you will, of the kidney. So this is where the kidney flows down into the ureter. This is kind of a big wide area that kind of flows down into a more narrow area, which is your ureter. And then there's the actual calices or calices, which are the little pockets inside of the kidney itself. So when it comes to hydronephrosis, the first line of defense of the body, because the body is smart. Evolution has gotten us to a point inside of a number of different systems of our body where there are kind of fail-safes that are set in place to be able to handle problems as they arrive. And our body's kidneys are no such exception, and they have a very, very well thought out system in order to handle hydronephrosis. So, when it comes to a kidney stone that is causing a blockage in your kidney, or that has caused a blockage in the ureter that is leading to a urine backup in your kidney, the first line of defense is going to be expansion of the renal pelvis. So this river delta, if you will, that takes this urine that's coming out of this kidney here, this will start to expand to a pretty wide extent. They can get pretty big if you've ever seen an image of an ultrasound or a CT scan, but it has a pretty high degree of flexibility and it can take quite a bit. So in the grade 1 presentations of mild hydronephrosis, the renal pelvis is going to be expanding here to be able to accommodate for that urine backage that is caused by the kidney stone, kind of interrupting or disrupting the flow of your urine. So this is first line defense. And with this presentation, as we had talked about in the previous video, there's really not any pain and you really don't even notice much of a pressure sensation, but it's certainly visible on imaging. Now, once that first line of defense is overrun and the body's like, okay, where are we going to go next with this excess urine that we've got backing up in our system? The calices or the calices are the next place that this is going to go. So the renal pelvis is probably going to stay a little bit inflated, but now we're going to start to see urine that is going to start to pool and collect more so up into these calices. And typically these calices have a little bit of a pyramid type of a shape to them. And this drawing is really super crude and not at all to scale, so don't put any credit in this. But nevertheless, they'll start to lose some of that pyramid shape as some of that urine starts to pool in there and starts to push outward as expansion continues. So, first line of defense, renal pelvis starts to puff up a little bit, and then next, as that is overrun, we start to see urine going out into the calices. Now, after those first and second line defenses have been overrun, the kidney now has another couple steps in order to help try to stave off damage to itself for as long as it possibly can. So when we're now talking about the next line of defense, we're talking about the more exterior portions of the kidney, which is going to be called the renal parenchyma. And the renal parenchyma is made up of two components, just like the pelvicalyceal system is made up of two. The renal parenchyma has two as well, and that is going to be composed of the medulla, which is kind of the fleshy exterior kind of interior part here that surround the different calices. And the medulla is in a healthy adult, about 14 to 15 millimeters thick. So there's quite a bit of room, a cushion there. And then there's the cortex, and the cortex is the exterior shell, if you will, on the outside of the kidney, which is about 6 millimeters thick in a healthy adult. So this is kind of spreading outward, as you will, as the kidney or has the urine backing up into the kidney. So the third line of defense when a kidney is managing hydronephrosis is that we've got, okay, well, let's just back up here. So we got urine pulling up here in the renal pelvis. We've got urine backing up into the calices, and the next place that urine is going to be able to go is we're starting to expand out here. So the calices full of urine start to press on the medulla, and it starts to thin out, and we again see less definition in these pyramid type of shapes of these calices, and the medulla actually starts to reduce in size, sometimes up to 50%. And that can all vary because there are different shades of grade. So if we're looking at this in the context of the different severities of hydronephrosis, we've got the first line of defense here, renal pelvis expansion, that's grade 1. Grade 2 would be the calices starting to fill with urine, and now we're kind of knocking on the door of grade 3, which is we're starting to see this expansion out into the medulla, and the medulla is starting to decrease in size. So from 14 to 15 millimeters in a healthy normal kidney, now it's potentially going to go down to about, let's say, about 6, 7, 8 millimeters in size. And again, the kidney calices are starting to expand out there. As a consequence of this expansion now that is imposing on the medulla, which is a part of the renal parenchyma, we're now going to experience a couple new things that we really didn't experience much in grades 1 and grade 2 when we had just the renal pelvis and the calices expanding. And those two things are pain and pressure. So when we're talking about the medulla expansion, in terms of pain, it's about a 5 out of 10. It's enough to definitely get your attention, and you're going to be a little bit uncomfortable, but there's also now going to be a sense of pretty consistent low-grade pressure. So you're going to sense something's happening in the back region, mid-back region where your kidneys are located, or at least on the side that your kidney is being impacted that has a stone. So these two things are really kind of telltale signs that, hey, we're dealing with grade 3 hydronephrosis because the body's on its third line of defense where it's now starting to expand into that exterior renal parenchyma, and the medulla is starting to shrink and shrink and shrink because the calices continue to expand with urine. Now, if the medulla, that third line defense that the kidney has in order to protect itself from damage, gets overrun because the backup is just so great of urine, we're now going to start to see this fourth line of defense go into effect, which is that cortex, which is that exterior shell, is now going to start to expand as well. And this is where really severe pain comes in, because the cortex of the kidney is actually kind of a tough exterior. It's very firm, so it is not as flexible and resilient as the lesser degrees or the previous lines of defense. The renal pelvis is super flexible. The calices have a very, very high degree of flexibility. The medulla has a little bit less, and that's why you start to feel a little bit of pain in this process. But when we get to this fourth grade of severe hydronephrosis, where the actual cortex of the kidney itself is starting to be impacted, you're going to be presented with some pretty severe pain. You know, this is kind of 9 out of 10, maybe 10 out of 10, depending upon how sensitive you are, but it's going to set off a ton of alarm bells, and it's going to be pretty significant pain. And this makes sense because, again, the body is very, very highly intelligent in the way that it protects itself and the different systems it has in place. So as we walk through all these different lines of defense, you know, we're now starting to stretch this kidney, and it's doing the best that it can to protect itself, but it's also giving us signals that go, hey, there's a problem. You need to do something about it. So when we get to grade 4 hydronephrosis and we start to see the expansion of this cortex, the kidney again is just screaming and it's in pain, it's being stretched, those nerve endings are on fire. And as a result, you're going to be in pain. And that's a good thing because that pain is what spurs people to action. So if you're in intense pain, 9 out of 10 pain for more than 6 hours, this is the signal to you that you gotta go get medical attention. Something needs to be done so that you can start having urine flow again to prevent permanent damage to your kidney, which can happen if you let this persist for more than 24 to 48 hours. So, I hope all this makes sense so far, but basically the kidney just has a tiered system for the way that it goes about managing a backup of urine in order to prevent damage to the kidney. And you're gonna get little signals along the way, knowing and the body's gonna let you know that there is a problem. So for those of you out there who have kidney stone and you've been sent home and they've been told that you've got a mild grade of hydronephrosis, understand that the risk to damage of your kidney is very, very low, and you don't need to be concerned about the damage to your kidney, because by the time that it gets to the 3rd or the 4th grade of hydronephrosis where damage starts to come into the picture, you're likely already going to have done something about it, because it is just so uncomfortable and so painful. Now, when it comes to a urologist or an imaging technician actually assessing the degrees of hydronephrosis, what they're looking at is the quality of the parenchyma. This is really going to be the biggest determinant for what grade that they're going to assess, because all these other factors, the renal pelvis can expand to different degrees, calices, the same thing. But when it comes to the renal parenchyma, if we start to see thinning of the medulla and or of the actual cortex itself, logically, all these other things are in place because they are forcing the expansion of the lip. So when a technician is looking at that quality is what's being analyzed. And the quality comprises both thickness, so thickness of the medulla, and the cortex, so how much do we have left of this? And then there's also the appearance as well, because on certain imaging modalities, stress, injury, cysts, and things along those lines that are typically indicative of kidney damage, either from previous kidney stone events or even a current event that's happening, is pretty visible. And I've drew a little crude little cyst here, but typically cysts and other type of injuries on the kidney are indicative of damage, and this can put a person in an even more riskier situation, because if you have a damaged kidney, its ability to run through these 4 lines of preventative defenses to help protect itself gets diminished pretty quickly. So the imaging technician and the urologist are going to take a look at that in combination with judging the thickness or the health of the kidney, depending upon the amount of backup that is presented. So in recap, this is a lot of information. And as always, we have put together a handy PDF guide that will help you capture all this information in a much easier to digest format with visuals. So if you haven't already checked it out from our previous video, I'd encourage you to head over to stone-relief.com/pages/hydronephrosis to get your free PDF guide on hydronephrosis, because it is super handy to be able to have when you're having a discussion with your urologist or a medical technician, or just to give yourself a peace of mind to know that, hey, I have a kidney stone, I have a mild grade of hydronephrosis, but I don't need to be concerned about kidney damage because my body's going to tell me if I'm at risk for damage because of all the pain that I'm going to be in. So I hope that you found value in all this. If you did, please don't forget to hit that subscribe button. And as always, please leave any comments or questions down below in this comment section, and we answer all of them. Thank you again for sticking with us here, and we will see you again in the next video. Thank you, everyone.